Somatic Symptom Disorder by Bertucio. What is it? Somatic symptom disorder is when an individual takes on physical pain in response to psychological stress. Physical symptoms can, but usually are associated with an underlying medical condition. Excessive thoughts, feelings, or behaviors from an individual. There's a high level of anxiety about own well-being and things happening to them on a daily basis. Usually at least one constant symptom with others coming and going. The history of somatic disorder is pretty brief. It was first discovered in 1859 by Paul Burkett when people complained of pain in different organ systems, but nothing was wrong with them physically. So the recaps are first known as Burkett syndrome, named after Paul Burkett, and was found to be rare in males while it occurs in 0.2 to 0.3% of females. Symptoms and potential causes of somatic disorder. An individual with somatic disorder may experience the following symptoms. Neurological symptoms include headaches, movement disorders, dizziness, and fainting. Physical symptoms include pain anywhere on or in the body. An individual most of the time doesn't actually have the pain actually occurring. It's more of a psychological thing. Potential causes of somatic disorder can be biological susceptibility, more common in women than men, emotional stress as a child, poor awareness of emotions during childhood, excessive anxiety, too much attention on bodily processes and illness and symptoms, childhood physical and sexual abuse, or other problems.
In somatoform and related disorders. In this lecture, we'll discuss the presentation and treatment approaches to such disorders. So let's look at the first case. Deborah is a 44-year-old woman who has visited the doctor multiple times, and none of them have been able to diagnose her condition. Today she presents with ankle pain, chest pain, back pain, headaches, blurred vision, bloating, chest tightness, tingling in her fingers, aching in her legs, and ear pain. Does anyone know what the diagnosis is? Well, this case illustrates somatic symptom disorder. Why? Well, it's a disorder where one or more somatic symptoms that are distressing result in problems in functioning. Well done if you got somatic symptom disorder, by the way. So in terms of risk factors for somatic symptom disorder, well, this disorder affects women more than men. It's usually inversely related to socioeconomic status. It usually begins by the age of 30. Data suggests that there may be a genetic linkage to somatic symptom disorder. Within families, male relatives tend to have antisocial personality disorder, whereas female relatives tend to have histrionic personality disorder. What typical symptoms may you see? Well, many physical symptoms affecting many organ systems, excessive thoughts, feelings, or behaviours related to the somatic symptoms, long, complicated medical histories, interpersonal and psychological problems may also be present, commonly associated with major depressive disorders, personality disorders, substance-related disorders, generalized anxiety disorders, and phobias. Patients will usually seek out treatment and have a significant impairment in their level of functioning. So how do we treat these individuals? Well, you must have a single identified physician as the primary caretaker. Patients should be seen during regularly brief monthly appointments. Should increase the patient's awareness of the possibility that the symptoms are psychological in nature. Individual psychotherapy is needed to help patients cope with their symptoms and develop other ways of expressing their feelings. The main key message overall I want to echo is safeguarding. These patients with somatic symptom disorder, they should only have one physician to see them on a regular basis, given the fact that in the future something physically wrong may actually happen to them, and you need to be able to pick up on that. So let's look at another.
Treatments for somatic symptom disorder. The goal of treatment for somatic disorder is to help make it easier for an individual to function in daily life without the pain they are having. First treatment can be psychotherapy, aka talk therapy is one way for people with somatic disorder to talk things out and express their daily stress or feelings of pain. It can also help with anxiety and depression. Talking therapy is a very good use for other people and other disorders, but it helps a lot with somatic disorder. Cognitive behavioral therapy, or CBT, helps improve physical symptoms of pain. Medications include antidepressants that will help depression.
Sometimes your child may complain of headaches or stomach aches, and it really doesn't mean much. But sometimes it's a little bit more. We're here with Dr. Brittany Barber Garcia of Spectrum Health Medical Group. Let's talk a little bit about somatic symptoms.
Absolutely. So somatic symptoms are really just any symptom that you experience in your body. And so that can be something like a headache or a stomach, or it could be something more, feeling faint, feeling shaky, maybe feeling weakness or something like that. And sometimes those symptoms don't really mean anything. They come and go with no problem. When those symptoms persist, though, we tend to be more concerned about them. Now, somatic symptoms can come about sometimes for very physical reasons. Someone may have something, a diagnosis like Crohn's or celiac disease, or sometimes migraines. But sometimes these somatic symptoms can also come about for reasons of psychological stress. And that's when someone like me, a pediatric psychologist, starts to get involved.
Yeah, what are some of the signs that we should look for?
Absolutely. So in children, we want to pay attention to when kids are starting to complain of these symptoms more frequently, more days than not. We also want to pay attention to when these symptoms start to interrupt their everyday functioning. So if kids are having trouble getting to school on time or making it through the school day, if maybe they're saying they don't want to hang out with their friends or they're missing out on extracurricular activities, certainly we want to pay attention to that as well. And we also want to pay attention to any signs of potential escalating symptoms of low mood or anxiety or stress, because those could actually be contributing to those somatic symptoms as well.
Yeah, how can parents help their children work through this condition?
First, these symptoms are real. They are distressing and overwhelming, so acknowledge them with your children, acknowledge that. And then help them to figure out, are there any things that are contributing to those symptoms also? And certainly ask your pediatrician for a referral to a pediatric psychologist. We're here and happy to help.
Statistics of somatic disorder. It occurs in 5 to 7% of the entire adult population. A survey of 12 to 16-year-olds found that somatic disorder is 11% in girls and 4% in boys. Society's response is not much on this disorder because they're still learning about it.
Joy of joys. Mr. Corman, you've joined us yet again. And what imaginary disease is ailing you this time, my good man?
This time he thinks he has the Yaba virus.
Your hair got longer, and I don't appreciate your tone.
Last month, you thought you had familial Mediterranean fever.
I was at my friend Kelly Papadopoulos' wedding, okay? I share a glass of ouzo with this guy named Janos. 20 minutes later, I'm in a cab. I gotta ask the guy to pull over because I'm gonna explode in some guy's rose garden. Now, what would you think?
Same thing I think right now. That you got yourself a bad case of the wish you were six.
Yeah, well, I read the symptoms on the internet, okay? I have Yaba.
Would you say you've been in contact with many exotic primates this year?
I have been to the zoo, yes.
And while you were there, did you go ahead and jump right into the cage and play toss the poop with the other monkeys? Because if you did, then yeah, you just might have Yaba. But if that's the case, it would be way, way down on the list of your problems. Give him a full workup.
Okay, Mr. Corman, you know the drill.
Here are my vitals. Here is the Mountain Dew. I'm just kidding. That's my urine sample. And you can start timing.
There are many famous people with somatic disorders. The first being David Beckham, who is a retired professional soccer player, and alongside him is Tim Howard, another retired professional soccer player. Some unexpected people are Leonardo DiCaprio, and some people that you might expect are Charlie Sheen and Howie Mandel. Hey Professor, just want to say that I had a really good semester in your class, and I hope that you enjoy your winter break. Thank you.